doctors, homeopathy from different fields join with us. So our only aim is to promote homeopathy and unite all the homeopathic doctors together in one platform. So many doctors from different part of the world coming here and sharing their experience, and many countries joined with us, and we are successfully continuing our journey. Thank you for the participants joining in our daily session. Your presence gives us strength and inspiration. And today's our guest is Dr. Raj Bondray from India, and he is a gold medalist when he got his graduation and postgraduate diploma in emergency medical service, and he is the professor of GMHMC Jalna and PG Gate GMHMC Jalna. He is the chief medical director of Brahma Madhurya Homeopathy Clinic, Aurangabad, and he is the first founder of first robotic case taking software. And today's our subject is homeopathy and its potential in rural areas. Welcome, Dr. Raj Bondray, to our Zoom session. And now you can talk. And your time is up to 9:15. After that, for 15 minutes, we will have a questionnaire. Thank you, doctor. You can start now.
Yeah, thank you, Dr. Ajini.
Yes.
Yes. So, to which country am I speaking to? Means you people are from Philippines.
No, we have many many countries joined with us, so we have many participants from.
But a larger group is from
India.
Okay. So myself, Dr. Raj Bondray, and I'll share my screen with you, and let's discuss about homeopathy with some cases. Okay. So there are doctors and students also.
Yes.
Students also. So our aim here is to promote homeopathy and show the potential of homeopathy to everyone, so that everyone should practice homeopathy and make this science go to the smallest level, to the level where people are needed for this thing, and to the level where the science would help every disease, every patient. So let's start with some cases. So I would like to tell you about a quote of Elon Musk. He tells that when something is important enough, you do it. And even if the odds are not in your favor, you will do it. So this sums up something tells about my story. About I wanted to practice in a local area where people are not able to speak English, and they're not aware that why do we ask dreams, why do we ask fears. So that I wanted to show them that you can be healed with this science, and this small sweet pills can help you. So we'll start with cases. So you would see that how people start learning about this science and they enjoy. So this is a case of gangrene. This is a case I got a call from one of my junior that there is a patient with diabetic foot. The blood sugar level was 500, and there was lot of burning pain in the limb. She was having fever, chills, and she was told for the amputation thing. And the junior told me that, sir, can you come to the our village and see the patient? So I went there and I saw the patient, and it was very difficult because it is very difficult to judge the vitality of the patient, the vital parameters of the patient, and how can we be very firm on our prescription, and should we advise her to not amputate, and we just need to save her limb and her life at the same time. So it is a dilemmatic situation. So these are the pics when I went there. You can see the gangrenous tissue. Now, what is the case? She was not hospitalized, no investigation. I didn't see any type of investigations. She had lot of vomiting, chills and fever. There was too much burning in the wound. Septic fluid was oozing, and the symptom was the burning pain was ameliorated by warmth. I told for the investigations like KFT, blood sugar, and other things. Now, what are the challenges in such cases? That we need to prevent the gangrene, we need to treat the pain, we need to prevent the patient to land up from septic shock, we need to prevent from bone necrosis, and at the same time we need to prevent the limb from getting amputated. So you need to be very much aware about the phenomenon. How would you judge the vitality of this type of patient? And at the same time, you should not land up into a trouble, but you should be able to help the patient also. So after follow-up, after 3 days of follow-up, the vomiting stopped, chills reduced, fever reduced, burning pain also reduced. And this is the follow-up after 3 days. After some 8 days, I think, 6 days. Now, after 5 days, the burning pain was reduced to a considerable level, discharge also reduced, and I could see some signs of healing. And now the patient could come to my clinic. Okay, so this is the follow-up in my clinic. So now you can see some granulomatous tissue here, this pink one. Okay, here we need to, whenever a patient comes, don't be shy to learn. Just go to your pathology book, go to the gangrene, read the details, go to the inflammatory state, what are the inflammatory state, what are the inflammatory mediators released, what is the duration of the state, and in how many days granulation tissue should form. We should read everything in every patient, we should try every day. So this was the follow-up after some 10 days. Here you can see the dead part is getting off. Now, a follow-up after 20 days, all the dead part was getting detached automatically. The discharge also started reducing, and I could see some wound healing, and there were no chills, no fever, no vomiting. So that patient could stay at her home now. So this is the thing, all the dead part is gone now. Okay, after this is after 20-30 days. Okay, all the dead part is gone. You can see. Now here it is very difficult to convince the patient to stay with homeopathy, and at the same time I took this patient to various surgeons also, so that I could see that, sir, can I wait? But it was very difficult. Everyone said do amputation, but I on myself, just based on the investigations, her physical vitality and her symptomatic state and her state of the physical complaint, I just gave the remedy and follow up. So all the dead part is gone after some days. And this is the total follow up, my dear friends, after 6 months of the story. And we were able to save her limb. You can see the great healing. And this is the miracle of homeopathy. And this has given a lot of trust with the rural people. What we want is every people who doesn't even understand homeopathy should come to homeopathy, should take homeopathy and get benefit from this solid science. And this we can do with homeopathy. So this is our follow-up. This is in Hindi. If someone understands. अभी दर्द है क्या? अभी दर्द नहीं है, रात में थोड़ा दर्द होती है। अच्छा, और मतली उल्टी? पहले क्या होता था? पहले मतली उल्टी हो जाती थी शाम को। और खाना खाए तो। और पैर में क्या होता था? पैर में मुंगे है, आज भी मुंगे है। पहले क्या होता था पैर में? पहले को मुंगे से दर्द ही नहीं होता था ज़्यादा, इसमें होता था। ये इधर पैर में दर्द नहीं होता था? ये पैर में होता था ना। हाँ, तो वही तो मैं पूछ रहा। ये पाँव में होता था। कितना दर्द होता था? बहुत होता था, कम हो गया। अब कम हो गया क्या? कितना कम हुआ? 8 वारी कम हुआ। कितना दिन में?
अभी आपको इलाज करेगा
कितने दिन हो गए?
कितने दिन हो गए
4 दिन में फर्क गिर गया
ऐसा क्या? अच्छा. So homeopathy is very fast. We doctors are slow, or we lack somewhere. We lack in our knowledge and our practice. We need to study every day, refine ourselves, refine our material, repertory, our clinical knowledge, and it will help in every case. So this is the. Now we'll see the analysis part of the case. Now, whenever I analyze a case, I first take a very general picture of the case. Now here, anybody can tell that there was a gangrene in lower limb, gangrene feet, and how is the wound? There was burning, smarting, and the wound was gangrenous. There was no reaction in the wound. And after repertorizing the whole case, I could see some group of remedies. And usually, every time I read every remedy, I start from back, like China, nitric acid, pyrogenum, Lyco, Crotalus, Vipera. Don't go from start. And you need to see, we need peculiarities where I saw pain, warmth, amelioration is one of the peculiarity in this case. And all the other things are general respective to the gangrene. We can find it in everywhere. So we should read the every case, every remedy like pyrogenum, vipera, anthracinum, echinacea, then merxol, calendula, lachesis, arsenic. And on this basis, I prescribed her arsenic, and very common remedy, but this helped the patient. I had prescribed her every 3 hourly, and this helped her to heal the thing. So, what are the comparative remedies? Lachesis, Botrop, Sickle Core. So, this is the case. Anything, any questions, or anything that we can discuss here?
Yes, we will have questions after the session now. Okay.
Right. But I could understand something like what the participants need, or isn't the chat section on?
Yeah, it's on, doctor, but it will take more time. We will finish the session and then we'll go for questionnaire. That will be nice.
Okay. Now, next case. So I moved to a case where I got a phone call from my friend, and he was also a doctor. He told me the happiness news that his wife delivered a baby, but he told that he's having convulsions, and even after taking allopathic treatment, baby is not able to come to a normal status epilepticus condition. So I was very much surprised, and I also got very anxious. Like, how will I be able to help this patient, and how will I get the case? So I just thought that let's focus on our learning and मेहनत करेंगे, देखते आगे कुछ जमा तो जमा. So I went into the hospital, and his mother was admitted in the other hospital, baby was admitted in other hospital. He was on some allopathic medicines, and though on all the medicines the convulsions were not getting better. So I went there and I just did observation. I didn't notice anything, I didn't get anything. So I thought what we should do, and if I ask the doctor, he'll not tell me anything. I just asked the nurse. She was attending the case. I asked her that, can you help me? Can you tell me something about the case? She told that, yes sir, he is having convulsions. I told that, how do you see? What are the things that you observe? And she was like God to me in this case. And she told me 2-3 things which were very peculiar, which helped me. She told, sir, ये इसको है ना ऐसे गुचके आ रहे हैं बच्चे को छोटा छोटा. तो मैं बोला, अरे बाप रे, बहुत एकदम ये मदद करेगा अपने को. कुछ तो मिला, कुछ नहीं के. So I got something so that I could find it anywhere in material or repertory. And she also told me that ये बच्चा का है ना ऐसा ऐसा सो रहा है ऐसा ये ऐसा उंगली ऐसा करके जब भी कन्वर्जन होता है तो. So I took this thing and I just went at home and I analyzed the case. So this is the follow-up, but this is in Marathi. I think anybody would understand Marathi.
दिनांक 30/10/2017 मला मुलगा झाला. मुलगा झाल्याच्या नंतर लगेच एक 2 ते 3 तासांनी त्याला सीझर आले, म्हणजेच कन्व्हर्जन झटके. ते झटके आल्याच्या नंतर त्याला ॲलोपॅथी डॉक्टरांकडे NICU मध्ये ऍडमिट केलं. ऍडमिट केल्याच्या नंतर त्यांची ट्रीटमेंट सुरू झाल्याच्या नंतर सुद्धा 2 दिवस कंटिन्यू त्याला झटके चालू होते. आमचे तज्ञ मित्र डॉक्टर राज बोंद्रे, होमिओपॅथिक तज्ञ, यांच्याशी संपर्क साधला असता त्यांनी ट्रीटमेंट चालू असलेल्या हॉस्पिटलला येऊन व्हिजिट दिली. व्हिजिट दिल्याच्या नंतर माझ्या मुलाची केस टेकिंग केली. केस टेकिंग केल्याच्या नंतर रेपट्रायझेशन केल्याच्या नंतर त्यांनी माझ्या मुलासाठी औषध दिलं. औषध दिल्याच्या नंतर एक 3 तासाने पूर्णपणे त्याचे झटके बंद झालेले आहेत. थँक्स
So
डॉक्टर.
within 3 hours all the convulsions stopped.
झटके नाही
तुम्ही औषध दिल्यापासून एकदाच आला होता. औषध आपण 3 दिवस कंटिन्यू केलं. त्याच्यानंतर आज जवळपास 7 दिवस झाले झटके बंद आहे. माझं बाळ पूर्णपणे कॉन्शियस आहे, अलर्ट आहे, बॉडीची मुवमेंट व्यवस्थित आहे. न्यूरोलॉजिकल डिफिसिट वाटत होतो, तोही पूर्णपणे बरा वाटतो. ट्राय पण केलंय, फीडिंग पण चालू आहे.
औषध कसं देत होते तुम्ही?
सुरुवातीला 10 मिली मध्ये एक 4 ड्रॉप औषधचे देऊन त्याच्यातलं 1 मिली 2 टाइम सकाळ संध्याकाळ दिलं. त्याच्यानंतर एक झटका पुन्हा आल्याच्या नंतर 3 वेळेस केलं आणि नंतर टॅपर करून 3 दिवसात औषध बंद केलं.
आता त्याचे सगळे एपिलेप्सीचे औषध बंद आहेत का?
पूर्णपणे बंद आहे.
कोणते कोणते?
ॲलोपॅथिक लेव्हिप्रिल म्हणून असते, त्याच्यानंतर एक टोपामॅक म्हणून असतं एपिलिप्टिक, त्याच्यानंतर सेडेशनचं मिडास आणि रिव्होट्रिल टॅबलेट म्हणून असते, ते पूर्णपणे औषध.
आणि होमिओपॅथीची पण बंद आहेत?
होमिओपॅथीची सुद्धा बंद आहे.
So later we stopped the homeopathy medicines also and allopathy medicines also. So let's analyze this case. So what basic things which we got through this case and which everyone should agree. We should be just very much subjective to the case, and we should be a very silent observer in every case, where we should take those things which everyone could agree and which the patient tells, which we feel is not a true thing to practice. So you'll take the symptoms as general thing, convulsion in children, then convulsion in newborn, and which 2-3 things which we were peculiar and which were told by nurse to us. So the baby had hiccup during convulsions, okay, and he had clenched fingers. So what are the remedies which are very specific to the pathology and having these particular symptoms? Cicuta, cuprum, Oinantha crocata, Artemisia vulgaris, Bufo. So these are the remedies which come to the picture. Okay. Now we would analyze through materia medica which are the particular symptoms which are very peculiar in the remedy, which should be there in the remedy which we are going to prescribe. So we came to cuprum metallicum, and if we read from Phatak materia medica, here it is written clenching of thumb in palms. This is what we need. We don't need any fantasy. We just need what our stalwarts say and what our patients say. We are just a layman, where we are going to take the truth and very objective symptoms, not subjective. First I talked subjective, it was wrong. And next thing is hiccup before vomiting or convulsions. So this is a symptom which is very peculiar to the case, and then we could prescribe the baby cuprum. We just gave in half a cup of water, we put 8 drops, and then 1 teaspoon every hourly we gave this baby. And this was the case. So let's move to the other case. This case is about dry gangrene. Now, the first case which I treated about gangrene, this patient gave me this thing. But every gangrene is different. There are some different things. That was diabetic gangrene. This is a dry gangrene. And here, if I saw the reports and there was thrombus in the femoral artery. Now, in every case, we should have watch everywhere. We should have an eye on pathology, on the clinical symptoms, on the mental symptoms, in the fear, in the dream, in the physicals, in the particulars, and wherever we could get any type of perfect symptom, we should just try to find out that thing in our literature. Okay, so this patient was a chronic smoker and had severe pain. His one finger or thumb of the feet was amputated, toe, and there was intense burning in the whole lower limb. One of the symptoms which he told me that he cannot extend the limb, okay, and he need to keep it folded, and whenever he folds the limb there is amelioration in the pain. So this is the amputated toe, and he is having thrombus in the femoral artery. So now he is advised to below knee amputation or above thigh amputation. So now our aim is here, he should get relieved from the pain, and we should be able to save his limb and from future gangrene formation also. So this is the picture. So this is the thing, and this is the follow-up.
कसं झोपावं लागायचं पहिले?
Now
काय
he tells the position. He used to sleep in this position only every night. He couldn't extend his limb.
आणि आता आता
He
झोपता
couldn't
येतं का?
extend his limb.
अच्छा, असं झोपता येतं आता.
Now he can sleep and extend his limb.
पहिले
And this is the audio testimonial. I called his wife after 3 years to see what happened after 3 years. This is a case before 3 years. Okay. I wanted to see whether he amputate or not after 3 years. Okay. I was not in contact with him.
Hello.
हा खडेकरजीचा फोन नंबर आहे का हा?
हा हा खडेकर.
म्हणलं डॉक्टर बोंद्रे बोलतो जालन्यावरून.
हा बोला, काय चाललंय?
कशी तब्येत आहे?
तब्येत बरी आहे.
पेशंटची तब्येत कशी आहे आमच्या?
तुमच्या पेशंटची पण चांगली आहे, पण ते काल पुण्याला गेले डोळ्याचं ऑपरेशन करण्यासाठी.
नाही, पायाचा त्रास कसा आहे त्यांच्या?
पायाचं बरं आहे, ठीक आहे आता.
पायाचं पुढं काही ऑपरेशन नाही करावं लागलं ना?
नाही नाही नाही, येऊ एखाद दिवशी भेटायला तुम्हाला.
नाही, पण पायाला बरं लागलं ना?
हो, एकदम जखम निर्मळ झाली आता.
दुखत नाही ना?
नाही नाही, दुखत नाही, काय नाही. गोळ्या कमी पडल्यावर मग थोडी आग होती पायात.
चालते बोलतेत ना?
हा, ते जर गोळ्या त्यानं 4-8 दिवस बंद केल्या तर मग आग होती.
चालतेत फिरतेत का?
हो.
चालतं, ओके ओके, बरं बरं. So I asked whether he walks now. She told that now he is very good and he is able to walk, do his things. So let's analyze this case. In every case where we could take some pathological symptom and then come to a very particular totality, and whatever picture of the patient we would have, we would go to the case. So the pathology of the case is thrombus in the lower limb. Okay, everyone could agree this. And there is gangrene in lower limb, there is gangrene in feet, the gangrene is dry, and this is one of the symptoms of dead people, dreams of dead people. So if we would say the remedies here, now focus on the remedies which are specific to thrombus and gangrene formation. So arsenic is here, lachesis is here, bothrops is here, Vipera is here, sulfuric acid is here, anthracinum, Crotalus horridus. And if we this is the other analysis of this case where we could see a total picture. Extreme affection is of lower limb, affected is toe, first toe is affected, and bluish lower limb, extremities bluish, gangrene of lower limb. The threatened, gangrene is threatened, and thrombosis of lower limb, wound is slow to heal, and affinity of blood and artery. We need a remedy which affects blood vessels, arteries, and there is thrombosis. Now here we can see the remedies: arsenic, lachesis, bothropes, apis, and asafoetida. So these are the remedies which could help this patient, but we need a very specific, very particular remedy which could have this type of pathology. So we'll see, and we prescribed in the remedy bothropes. Why did we prescribe? If you read bothropes from Fata, it says the venom of this snake is most coagulating. Therefore, it is expected to be useful in thrombosis and thrombotic affections. So we need this much preciseness we need, and it is given by the stalwarts. Since long, this has been written. And if we read Fata, bothropes, other section, here they show bone becomes bare from gangrene. Isn't it visible in this patient? See, this is though after amputation, but it is not healing after amputation. It should have healed. It is not healing. So bone becomes necrotic. So in this way, which we had prescribed him bothropes, and these bothropes helped this man, and homeopathy has saved the lower limb. He is very happy. In this way, our homeopathy can save we can do innumerable change in the society. So 2-3 cases I shared about where we have analyzed according to different picture and taking different symptoms. In a case we have taken some particular thing, in a case we have taken some particular rubric of warmth amelioration. Now we'll see a case where there is nothing to observe, means or to get from the patient. We need to prescribe here just through observation. How can we prescribe it these type of cases? Okay. And there are various things like how can we use which type of repertory where, when to use boric repertory, when to use Patak repertory, when to use Nair repertory, when to use complete, Kent. It is according to the case. If a case comes to us and he tells me, sir, ये sonography का report है, इसमें
It's 21 hours.
मेरे bladder के अंदर stone है, and he is not able to tell any symptom, we are not able to get any type of symptom. It is just a clinical case. In this type of cases, we could go to an author whose repertory is just based on those clinical symptoms, so that we could go on boric or Fata in this way. Or if we get a case, I had a case where a patient came, sir, बहुत खुजली, nothing, no symptom at all. Okay. So in that case, I used Nair repertory, because Nair repertory is a layman repertory. It was written, what was the philosophy background of the Nair repertory? It was written in a layman language, a common man language. So both khujli, bas dhundo Nair repertory. In this way we can work. So let's see the case of alopecia. So here in this case, I didn't get any type of symptom at all. Here you can prescribe only on this photo. So let me know your observations about it, or in what way you could prescribe here. No, I can't hear. Okay.
No,
So
all our participants are muted, so they will not be able to speak. Only thing they can do is they can chat possibly, but even sometimes we get some unwanted chats in our chat box, or sometimes it will be disabled.
Right. Okay,
Yeah.
okay. Let's be in a one-sided thing. Okay.
After this, after presentations, then we can have an open chat. I think they will be allowed to raise their hands and they can make their comments and interact with you.
Right. So let's see how can we analyze this case just by this thing. Okay, we don't have any dream, no fear, no, because I told about the rural area. Patient कुछ नहीं बता पाते, उनको लगता है ये क्या चल रहा है, डॉक्टर साहब ये देखो, बस ये दवाई दे दो, ये ठीक करो मेरा, वो बोलते हैं. So here we need to prescribe of this thing only. So I'll show you a follow-up photo. Now here's have seen, and this is complete picture, a complete cure. So how to analyze this case? Here we see how is the part, means how is the alopecia. I have seen many cases of alopecia, but I didn't get alopecia of this much large size. This size is very large. If you see her temporal, all the temporal part is covered, her vertex is covered, some part of her frontal bone is covered, and this patch is too much large. So I just took the symptom and I found out in their repertory. I searched every repertory. I wanted a symptom where I could see alopecia and large spot, and I found it in hair baldness spot large. What a miracle! And this is written in literature. We just need to find it anywhere. And if you see near Ifph self, hair baldness spot large, single remedy. So in this way we could be more precise, because there are not 5 remedies here. Okay, there is a single remedy rubric. Here we could vouch on this symptom. Okay, because we don't have anything to prescribe on. And this is the thing after 6 months. Okay, this took some lot of time after this, and then all this thing. And after Ifph self 30 BD for 5 days repeated every month, this is the result. So in this way, we need to be very flexible in our practice, and we need to be at the level of the patient. Like suppose patient is talking in Hindi, and we are very affectionate in our language. हाँ बताइए आपका क्या हो रहा है, ऐसा ऐसा ऐसा. तो पेशेंट जो भाषा में कर रहा है उसका जो टोन है, उसका जो एम्प्लीफिकेशन है, हम लोग अगर उसको मैच कर जाए तो ही विल बी एबल टू गिव यू हिज सिम्टम्स. अनलेस एंड अनटिल वो हम लोग को उसका कुछ दे, हम कुछ नहीं कर पाएंगे. सो every case we should be malleable. Gold is most malleable. In that way हम लोगों को वैसा malleable होना चाहिए हर एक केस में. वो कैसा बात करता है उसी के जैसा बात करना, वो कैसा टोन यूज करता है उसी के जैसा, वो गांव का है तो गांव के ही जैसा यूज करना. In that way we could get more and more symptoms. जब तक हम लोगों को कुछ सिम्टम नहीं मिलेगा तो ये हमारा डॉक्टर के कुछ फायदे करना. जस्ट उसको भगवान मान के कुछ भी करके उसमें कुछ ना कुछ मिलना चाहिए हर एक केस में. So let's focus on the case. So this is last case probably. There are many cases. So here we'll see a different approach. Okay, this is a case of psoriasis, and patient came. I'll show you the pictures first. Psoriasis. So this is the psoriasis of arms. Okay. This is the psoriasis. This is the psoriasis. So what is the case? There is lot of itching and patient coronavirus something was there.
Okay. No, please continue.
Right. So patient, I could get some symptoms here. She could give some symptoms. So she told me, sir, डॉक्टर साहब मुझे बहुत जल्दी गुस्सा आ जाता है, बहुत जल्दी. और whenever जब भी मुझे गुस्सा आता है तो मुझे ऐसा खुजली आता है, मेरा खुजली बढ़ जाता है गुस्सा आने के बाद में. And there are no specific dreams, no fear, and no other symptoms. So this is the case. We need to analyze on basis of these symptoms. So first, whenever we take such type of cases, we should first go to the pathology. What is the pathology? It is psoriasis. What is the affected part, my dear friends? For various psoriasis, psoriasis of scalp, Pustilagomedes, psoriasis of ankle, psoriasis of toe, Morgan Gartner, psoriasis of upper limb, different remedy, psoriasis of face, Pustilago, psoriasis of head, scalp, nitric acid, psoriasis of trunk, different remedy. So the part affinity is very important. So here parts are forearm is the one part, okay. Other part is feet and lower limb. Now we'll see the follow-up. This is the follow-up. See, okay. Chakachak. No cream, no steroid, nothing. Only our remedy. And this is the thing, and this is the thing. Okay. And we'll see her arms also. See, this is and this. All clear. All clear. And with this case, I got a very other thing also. Like this lady was, there was secondary infertility in this case. So, and they used to try for IUI, and this IUI also didn't benefit them. But my dear friends, they came for psoriasis, and homeopathy as an holistic science helped them with this secondary infertility also, and they conceived with the homeopathy medicine. Now let's analyze the case. Let's see the result. Let's see the analysis. And everywhere, my dear friends, whenever you see any type of lecture in homeopathy, just go behind the technique. Don't go behind repertory. Don't go behind remedy. Just learn the technique on what basis was it prescribed. What was the philosophy of that doctor? What was the ideology? What was the technique of that doctor behind the prescription? Because homeopathy is in science and art. And the art lies in every doctor. एक गांव का doctor, एक शहर का doctor, एक अंग्रेजी doctor, एक Philippines doctor. Every doctor has his or his own technique. We need to learn this type of techniques from everyone. So this is the case. Now let's see the symptoms. What did she tell us? There is psoriasis, okay. Admonition, aggravation. गुस्सा जल्दी आता है, anger easily. छोटी छोटी बात पे आता है, anger trifles about. And what most important she told us, डॉक्टर साहब जब भी मुझे गुस्सा आता है तो मुझे बहुत खुजली होता है. Psoriasis, excitement, emotion after. Okay. If we see in complete remedy for 3 marks, Staphylococcus aureus has been given. And the other remedies which we could compare, Lyco, Calcarea, nitric acid, or Mesarium, Petroleum. These could be the differential remedies in this case. And we had prescribed her Staphylococcus aureus, and it had given a marvelous result. Like we had prescribed 200 potency every 5 days in a month, and this was the result. So homeopathy has a lot of potential. Just we need to be there with the patient, and we need to be very objective, not subjective. Objective means what he tells. जो आप बोले वही सही, जो मुझे लगे वो सब गलत. Unprejudiced observer, and then it will help us in every case. So this was about my lecture. There are a lot of other cases which I will just show you the photos. This is the psoriasis, and renal failure cases where 7.5 creatinine, it comes to 2.1. Then eczema cases, then these eczema cases, then the acne cases, and so lot of cases, lot of things. So for every homeopath, I would tell, dream it and go for it. Just decide your path, just decide your goal, your manifest, and then achieve it, go for it. And for it, it doesn't come in a day. You need to strive day in and day out. You need to read material, you need to read repertory. Every case you need to be perfect. उसको कुछ भी करके ठीक होना ही चाहिए. वो दवाई हम लोगों को ढूंढना पड़ेगा, इसमें से ढूंढना पड़ेगा, उसमें से, और जबकि जभी वो जाएगा कल आएगा ऐसा नहीं. In those 5 minutes, 10 minutes, you need to be very precise. You need to have a godly energy at that time. And just focus on those symptoms and try to find out those symptoms. And it is very easy then.
Thank you, Doctor. It was excellent and appreciating your confidence also. Thank you so much. Now we will go for the question.
Right.
If anyone having question means, please raise your hands. Dr. Hubert. Dr. Hubert. You can ask question now.
Sir, you are not audible.
Can you hear me?
Yes.
Can you hear me?
Yes.
It was a great and excellent class. Thank you very much for that. So, how you could manage the first case? In the first case, how did you manage the sugar case? It was a sugar case. You
Yes.
yeah,
So,
highly diabetic. How could
yes,
you manage it?
it could land up in ketoacidosis, okay, and it is very difficult. So she should not land up into a surgical shock or a septic shock and ketoacidosis. At that time, I told her that you please for the for some every alternate day I did the fasting post meal, but it didn't come to a thing. So I told her that for sugar you need to go to take some allopathic medicines. Even after 2, 3, 6 months by allopathic medicines also, sugar was not maintained. So I told her to shift to other doctor, and they shifted her to insulin. And with insulin, her sugar could get to a level. And this took 6, 7, 8 months. Within that time, our healing part was also done.
Thank you, sir. The other case, the second case in amputated case, is it he is a smoker? Whether he is a
Yes,
smoker or not?
he was a chronic smoker.
Yeah. Okay. Thank you.
Right.
Thank you, Dr. Hubert.
Thank you very much.
Now, Dr. Sridhara Kurup.
Thank you very much. Thank you, Doctor. It was an excellent presentation. Dr. Raj, keep it up.
Thank you.
But I would like to ask whether it is some dressing with homeopathic medicine or any other even
Yes, sir.
allopathic medicine. What?
No, yes. I in this type of cases, I do what first by hydrogen peroxide, then by the beta iodine, and then I tell to the patient to use calendula as an external application in every gangrenous case.
And second question is that whether you are having any experience with the LM potency.
Yes, LM potency, it is very useful. Now here in this first case, if I practice in a rural area, it is very difficult to get remedies here. So if in this type of pathological cases, LM potency is used and in repetitive doses, it is very, very helpful.
Whether you usually using water dose or 5 dose.
I use water doses when I use LM potency.
Okay, thank you very much.
Or in some pathological cases where I need to repeat the medicine, or in some acute cases, I use water doses and it helps a lot.
Thank you very much. Excellent. Thank you.
Thank you, sir. Thank you.
Thank you, Dr. Sridhara Kurup. Now, Dr. Logamani Gupta.
Hello. Am I audible?
Yes,
Hello,
sir.
Gupta ji. Hello.
Welcome, sir.
Thank
A
you.
very nice presentation.
Thank you, sir. Thank you.
Very appreciable presentation you did. And lot of things are being learned by all of us.
Right, sir, right.
Sir,
Homeopathy is all about sharing. Everyone has many things. Every doctor has a different remedy which we can learn from him. A rubric or anything. Many things are there to learn.
definitely homeopathy is an art.
Yes.
And-
I remember a Hippocrates line that art is long, Life is short.
Yeah, definitely.
Opportunity transient and judgment difficult. So this type of opportunity to prescribe on a gangrenous case, and at that time we should be able to prescribe bothropes or arsenic. So it is a very difficult thing, but we should be ready with all our astras, materia, repertory and observation and all those things, and then we could prescribe everywhere and get good results and good success rate, decrease our failure rate.
So I also use Pathak repertory. It's a very good repertory.
Very good.
Very good repertory. Very short and concise repertory.
Yes, yes.
My question is this. As you showed in your pictures, some skin disease in palms of a lady.
Right.
I'm having a case of such type.
Okay.
She's a schizophrenic too.
Okay.
So I get good results sometimes, but it reoccurs. So please guide me. What should I ask to the patient and what should we prescribe to the patient? Just give me an idea so that I may proceed on.
You need to first focus on the you need to again retake the case by a fresh mindset, and then take the case from the zero level. Start from his start of his symptoms. First go to the particulars, complete the particular picture, and then go to every sector: his fear, his dreams, his sleep position, his like, his dislike, his aversion, his aggravating factors, his weather aggravating factors, or the suppose there is a white patch but it is present on both elbows. Okay, so in Fatak repertory there is a rubric symmetrical. Okay, if there is a the eruptions are there on this the one limb in right and the other in the left lower limb. In Fatak repertory there is rubric diagonal. So in this way we can use the repertory and analyze the case, but we need to be good observer also at the same time. Observe whatever things, just write it down and find it in any repertory wherever we could get it.
So if schizophrenia is treatable?
It is very difficult and I am not the perfect person to answer it because I couldn't get a good result in this type of cases. It is very difficult to treat.
Yeah.
And just keep the patient on homeopathy. Everything is possible, but it is my lacuna or it is lacuna about the doctor.
So definitely she is on homeopathic treatment. She is taking it very regular because all the family is having full confidence in me. But for the sake of my knowledge and for her benefit, I ask you guidance.
Right.
Thank you.
Thank you.
Thank you, Dr. Lokamani Gupta. And now Dr. Manoj.
Thank you, Dee. So congratulations, Dr. Raj.
Thank you.
You have done a splendid job. I think you must done it in two ways. First one, you did practice in a rural area.
Yes.
Very remarkable, and another thing, the hard work.
Yes.
Very important. So everybody will be able to treat homeopathically with these medicines with the help of the software and the hard work. That is most remarkable, and congratulations for Dr. Your presentation is very good. Then I think these types of presentations will substantiate the government of India's decision to give an exposure to the eye systems to the allopathic physicians, because the first case they are ready to amputate the patient's limb.
Right.
But you've done a good job. Congratulations. And I appeal you to participate regular in the Ifph forum, and we'll expect more from you. Thank you.
Thank you.
Thank you, Dr. Manoj. Now, Dr. Anand Jaiswal. Dr. Anand, you can ask now.
Good evening, everyone. Thank you, Dr. Raj, for your
Dr. Anand.
Can you hear me?
Yes, sir. But very feeble. You can speak more loudly.
Good evening, all. Thank you for your wonderful presentation. It's very impressive presentation. You have said about the different repertories about the cases. Can you tell me about the brief which case you prefer, which repertories? And the second one is you told me about the techniques. Can you brief what are your techniques to follow?
Right. The first question is about repertories. It's an learning. It's not an thing which could be explained in 5 minutes. It's an learning where you need to learn this thing with like which repertory to be used in which case. It comes through learning through masters. You should see some videos on YouTube about various people. Various people have various affinity or learning through various repertories. Like suppose I told about Fatak, some rubrics I told. When to use Kent repertory, when to use complete, or when to use boric. When you don't get any type of symptom and you just have some pathological symptom only, you need to prescribe on the pathology basis. You should go for boric or Fatak. And I told about the case of itching, where you just have single symptom. I showed also case of large patch of alopecia where I use Nair repertory. So in this way, you could use various repertories. And second is about technique is you need to draw those techniques by inference. You need to get that inference by seeing the lectures or sitting beside the doctor, seeing the videos on YouTube or taking some courses. In that way, we can learn.
Okay.
Okay, thank you. Now we have 7 more minutes, so make the questions short. Dr. Badran, you can ask question now. Thank you.
Right.
I'm not asking questions. I would like to congratulate Dr. Raj Bondray for his wonderful presentation and dareness to practice in the rural area and handle surgical cases very well and could do wonders in handling such cases. And your mode of prescription also was very fine. And to pathological cases, pathological prescription, to miasmatic cases, miasmatic prescription. This is very nice and useful, and will be enthusiastic to the juniors also. Thank you, Dr.
Thank you, Dr. Badran. Now, Dr. Danesh. Dr. Danesh, please.
Good evening, all.
Good evening. Good evening.
It's a very good presentation, sir. Congratulations for your wonderful presentation here. And we are having a very good dinner with homeopathic subject, and you have presented with very good style. That you have shown the world that a single remedy can do wonders in this sort of cases. But actually, I have a doubt to ask is that whether you use any external medicine for or applying cleaning the wound or anything like that.
I use external remedy only in the cases of gangrene. Okay. I use calendula.
Okay.
And also I use calendula as a supplementary remedy in mother tincture in internal doses also with the perfect constitutional remedy.
Okay. Anyway, we are very thankful for your wonderful presentation. I hope we will be coming here with more presentations so that we have seen that you have shown that a lot of cases are with you, and so you may please come up with your presentation regularly at this platform. Thank you for your presentation.
Thank you, Dr. Danesh. And once again, we need your presentation, Dr. Raj Bondray. Next is Tessitin Illeri. Tessitin Illeri, please.
Okay, am I audible?
Yeah, you are audible, yes.
Thank you very much for this amazing experience sharing. What is my question? At these times, what is your success rates and what is your failure rates?
My success rate is 65% and 40-35% cases they are failure cases, and this success rate is what we need to improve, and this can be improved just by our reading or updating our knowledge in every sense, by materia, by repertory. Every case I see 20-30 cases every day, and it is very difficult to prescribe for me in 10 minutes I get to prescribe. And in that time, I need to get the symptoms, I need to analyze in repertory, I need to write the case, I need to observe, I need to take photos, everything. And in that time, I need to read the remedy also. Like a convulsion case, I read 5 remedies, Oinantha, Artemisia, Bufo. I read those remedies. And unless and until we read every remedy every time, it would not get into us and we will not be able to prescribe at the time of jab chahiye tab nahi jamega. When it is essential, it will not come. Unless and until we'll go through it every day, every time we need to revise it and learn it.
Thank you very much again.
Right.
Thank you, Dr. Sitin. And next is Dr. Hariharan. Now you can ask questions. So I think we are finishing within 3 minutes.
Hello. Hello.
Yes, doctor, you are audible.
Hello, doctor. I want to know that you any experience with ulcer flavum and leukoderma? In leukoderma, you have any experience with the ulcer flavum? That is my question.
Yes. Leukoderma, it needs to get treated only by constitutional medicine.
Okay. Thank you.
We cannot treat it by a particular remedy.
Okay.
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 So you need to do it according to the case, as homeopathy says. So this is my email ID. You can put up your critics, your things which could improve me, and your questions and your review about the lecture on this email ID. This is my email ID. You can take it.
Okay.
Are you able to see it?
As a pathological remedy, you are not using ulcer flavum 3x?
As a pathological remedy, if I don't get any type of symptom, but if there is indication of ulcer flavum, then only I could prescribe it.
Okay. Thank you, doctor. Thank you.
I don't prescribe it because I feel patient should show something, somewhere.
Okay.
Right.
Okay.
Thank you, doctor. And now I'm calling Dr. Shaji Kudiat for giving vote of thanks to Dr. Raj Bondray. Dr. Shaji Kudiat, please.
Okay, thank you, Dr. Hajini. It is nice to have Dr. Raj.
I'm not able to see you, sir. I want to see you.
Yes,
Okay.
he's there.
Okay.
बताओ आपका चेहरा सबको कहाँ पे? अच्छा ये शाजी sir. Okay. You are there in lecture.
Yeah.
Yes, sir.
So thank you for your participation and your presentation in our forum. We are very proud of young homeopaths like you coming forward and giving wonderful experiences of effectiveness of homeopathic medicine, and it is shared to the world. Today we have participants from different parts of the world, and our programs, daily programs, are inspiring homeopathic doctors. Some of them are allopathic doctors trying to learn homeopathy, and India, being the hub of homeopathy, is able to inspire homeopathy doctors from different parts of the world. And we thank you for your great initiative and presence in our forum, for sharing your valuable, great effectiveness of examples of proof of effectiveness of homeopathy, and that will definitely become inspiration to many participants from different parts of the world, from Nepal, from Bangladesh, from Pakistan, from Turkey, from South America, many from everywhere. The participants are there. So I thank you for that, and we expect your presence more. We suggest you to refer more participants for our platform, so that their experience also will be shared. And once again, on behalf of International Forum for Promoting Homeopathy, and on behalf of all those who participated today, I extend a great big thank you to you, and see you again. And also I extend my thank you to all those who participated today in our forum.